Move Like a Mariner is a partnership between Central Coast Local Health Promotion Service and the Central Coast Mariners A-League team. It's all about getting moving and building confidence in fundamental movement skills and also developing a love of physical activity and sport from an early age.
We work with our local early childhood services and they initially sign a pledge to take part in physical activity with the children every day for 6 weeks. The educators are equipped by attending a training night where we run a workshop and run them through some games and skills that they can then play with the children back at the service. After they run the program, we ask them to complete an evaluation, and that's then part of the draw for them to win a visit by the Central Coast Mariners to attend their service for a full team visit.
Our outcomes have been really positive. We've seen an increase in physical activity within early childhood services on the Central Coast. In particular, confidence amongst educators to teach fundamental movement skills to children, in particular the 3 to 5-year-old age group. And these fundamental movement skills are actually the building blocks for more complex movement patterns that in turn will be important when children go to play sport later in life.
Our early childhood services across the Central Coast have been really eager to be involved. Over the 4 different years that we've run the program, we've had 108 services involved, which represents 9,000 children all being involved and engaged in this program. So I think that's an amazing outcome.
We've had some really wonderful feedback from the services and families involved, and I think this is really reflected in how popular the program is. Each year we come into Move Like a Mariner time, we have a lot of services reaching out to us, eager to participate again.
We are proud that we've been able to reach so many children through the program, and that's a great legacy for them to continue to build on these fundamental movement skills and hopefully participate in physical activity for their life.
Healthy Bites is all about providing bite-sized health advice to adults aged 50+, and that means providing practical tips so they can improve their health and well-being. And that might be around things such as what they eat, their fluid intake, how they can improve their strength and balance, look after their eyes and ears, and other things they can do to improve their well-being. It is a radio series that airs on Radio 50+.
So our aim was to be able to simplify healthy ageing information for people in the community. So it's about building health literacy of our community and enabling them to understand that the age-related changes that might be happening to them as they age are not complicated, and that there's really easy, practical steps that they can take to actually live and work with some of those changes to facilitate them being as independent as they want to be living in the community.
We've had some great anecdotal feedback on the episodes. Originally, it only started with the intention of being a few short episodes. That's changed. The radio station now has built it into a strategic plan because of the feedback it's had from listeners, people ringing into the station and saying that they enjoy the episodes, it provides great advice to them. But also we've had some great feedback from services as well across the district where they've been able to get across key messages to the community and to their clients and consumers as well.
This was a series that was designed to be broadcast once per week. They shortly came to us and asked for our series to be broadcast 5 days a week. And in some cases, we've had certain topics that have actually been broadcast twice daily. So I guess that's just some indication of just the response by the community to the series. Healthy Bites to me has been really important because we've been able to be a really important intermediary between the coalface of our clinical services and the community.
The urgent care service started in November last year, and it's a model of care to help our community access medical care in a timely manner.
The urgent care service is essentially a clinic which offers the local population on the Central Coast, particularly in the 2261 postcode, an option to be seen by doctor, physio, nurse to treat conditions that they may have presented to their ED or tried to get into their local GP for. I think the service has improved patient experience by really giving them that other option. Both EDs are excellent. They're very, very busy. So we provide an alternative for patients that really don't need to be in ED, so they have lesser acuity problems, and we can attend to those issues.
We survey the patient on arrival to the urgent care service, and we do 48-hour follow-up phone calls after they have been, just to ensure that their conditions have been resolved and if there's anything further we can provide care for. They have said that our service is exceptional, positive experience for them, and they really were grateful for the fact that they were able to get timely access to care.
I feel the success of the urgent care service to date is a real reflection of the assistance and collaboration we've had from all parts of the LHD, all different areas, and that's been amazing. To see it from just being on paper and planning, lots of meetings and talking, to actually going into the clinic yesterday, lots of patients, everybody very busy, everything happening seamlessly, is just fabulous.
I'm really proud of the urgent care service and the team that we've been able to promote and have this established in such a short period of time, and we will continue to see the difference it will make in our community.